Boa tarde. So technology has made our life better. And Steve Jobs, founder of Apple, is one example of an innovator that through technology has made our life certainly easier. Unfortunately, last month, Steve Jobs, as almost 12,000 people every year, had to receive a liver transplant. And as such, he is now part of a group of 60,000 people worldwide that needs to take every day, for the rest of his life, immune suppressive drugs to prevent transplant rejection. And even taking these drugs, about 1 in every 3 patients will eventually lose their transplant over 5 to 10 years. The overall immune suppressive market represents yearly about $5 billion, with liver transplantation alone accounting for 1/3 of this value. But these immune suppressive drugs can lead to very serious medical complications, the most important being high and frequent infections, high cancer rate, frequent infections, some of them life-threatening, and kidney failure. However, these patients need to take these drugs every time. If they stop taking these drugs, in spite of these problems, they will lose their transplant. So as you can see, there is a dire need for new treatments that would prevent graft rejection with fewer adverse effects and with a lower cost of follow-up care. Much of these costs is due to the medical complications of the drugs themselves. So a new therapy with a long-term benefit would be much welcome. We have developed a new cellular therapy that we named Acellera 1, or ACE1, that addresses these problems by being immune suppressive and liver specific. When we compare the efficacy of ACE1 with some of the most promising new drugs under development, and we compare these with Treg, that is a cellular therapy now under clinical trials, we found that the immune responses that lead to transplant rejection, represented in green, are reduced by ACE1 to the same extent that they are reduced with Tregs. But while ACE1, when injected in animals, localizes preferentially in the liver, being almost virtually undetected elsewhere, Tregs are not specific to the liver, and as such, they lead to the same complications as current immune suppressive drugs, infection, cancer, and all of that. So we believe, and we have reason to believe, that ACE1 is a paradigm shift technology as being the first immune suppressive drug with organ specificity. And as such, it has increased efficacy with fewer toxicity as current treatments, and representing an overall reduction in cost, mainly due to reduced medical complications. ACE1 results from a modification of cells isolated from the patient themselves that are modified through our patency technology. And ACE1 cells are then injected back into the patient where they migrate to the liver, thus preventing transplant rejection. So if you want to help us, to help Steve Jobs and many other people along the way, just get in touch or meet us at our poster. Thank you.